Today I will tell you about Alzheimer. Alzheimer is a disease that 50 million people and their families suffer on a daily basis. It's going to be considered the next pandemic of the century and should be treated like that. Despite more than 2,000 clinical trials that have been performed, nothing is working. And one of the reasons is because these trials has been based on a very narrow vision of the disease. In TETRANEURON, we consider that Alzheimer is a multifactorial disease, and a multifactorial disease requires a multifactorial treatment. And this is what I'm going to show you today, a therapy that is able to interact with most of the alterations that occur in the Alzheimer's brain. We are TETRANEURON, and we are a gene therapy biotech company spin-off of the Cajal Institute in Madrid. We are developing a gene therapy for Alzheimer's disease using a very radical new approach to brain and neurodegenerative conditions. We have discovered that E2F4 has a major play in the Alzheimer's disease. E2F4 is a transcriptional factor that is responsible of the neuronal homeostasis. And under stress condition, E2F4 is phosphorylated by P38 MAP kinase, inhibiting their function. These neurons that has a non-functional version of E2F4 start working badly. These neurons start working sending bad messages to the rest of the network, and that produce neuronal inflammation and the neuronal death. So we have demonstrated that the expression in the neuron of a modified version of E2F4 unable to become phosphorylated and totally functional restore the normal functions of the neuron. So based on our preclinical data, with one single injection of our gene therapy, we will be able not only to prevent the advance of the Alzheimer's disease, also to recover some aspects that have been already compromised. So we have been working during many years in that hypothesis, and currently we have a good portfolio of preclinical efficacy data approved in a murine model of Alzheimer's disease. We have safety and tox studies supporting our efficacy data. And most important, we have a clear CMC roadmap for the vector production. Comparing the other players that are in the same landscape, while others are only focusing to restore one single alteration in the pathogenesis, our target is able to interact and restore most of the alterations that occur in the Alzheimer's brain. For sure, Alzheimer is our first asset, and we are currently in preclinical development with the idea to start the clinical trials in the coming years. But we are not only working in Alzheimer, we are also exploring the efficacy of our target in other neurological conditions like glaucoma, Parkinson, or even aging. And finally, we have a very passionate and multidisciplinary team added by science and management and supported by a great group of advisors. For instance, we have one of the most important key opinion leaders in the Alzheimer working with us. And we believe that together with our investors and collaborators, we will be able to save the life of the future Alzheimer patients. Thank you.